Hey gang, Mark Sweeney here from Austin Dental Spa in beautiful Austin, Texas. Welcome to another version of Wisdom Wednesday. If you've tuned in before, we've been doing this for over 7 years now. Every Wednesday about this time of the day, our goal has been to bring you brand new, hot off the presses research, not only about the mouth, but also about just whole body health. If you've tuned in before, you know this, and we also end with a health tip every week that usually ties into the subject matter. This week is going to be no different. We're going to talk about whether your milk could be making you more anxious and your diet drinks could be affecting you from a depression standpoint. So before we get into that, I want to take this last opportunity, since I can't believe this is the last day of April, but we have a theme every month, and I'll introduce May's theme next week. But this month our theme was April Fuels, in which it took me the whole month to get that out instead of April Fools, but it was kind of a play on words intentionally, and so this is my last April Fools joke for this year, because tomorrow is May Day, and so we're going to introduce a whole new theme next week. But this week, as I mentioned, we've pulled off of this several times before. In the UK, over several decades, they did this study where they studied over 200,000 people, I think 211,000 people total, as they moved from their 20s into their 30s, into their 40s, into their 50s, and they had all different age groups represented, but they monitored them pretty much every day with their activity level, their dietary levels, and what they ate and didn't eat, how much they exercised, heart issues. They tracked all these different disease states too for like 40 years. Never been another study like that to my knowledge. And so at least 3 times in the past Wisdom Wednesdays, we've referenced this study called the UK Biobank. This week's going to be no different. This actually is a group out of China that did this study at one of the medical schools, Wenzhou Medical University in China, and they took this same sampling of people, but they looked at dietary stuff. Particularly, they looked at sweetened drinks with real sugar, artificially sweetened drinks, pure fruit juice and vegetable juices, milk, coffee, and tea. They went through those 6 different beverages, and they did 11 years worth of research. Now the study had already been done, but that information is available. I think one of the studies we quoted a couple of weeks ago was from Norway, that these Norway researchers accessed the same 40-year study from the UK. There was one from the United States, from Boston, that we did not too long ago, utilizing the research and the data from that same study. So this one, they had people 188,355 people, which is a huge sampling, between the ages of 37 and 73. So there were some limitations there, and they also looked at their online diet, which these people self-selected. So there potentially some dirty data in there where people don't always report exactly what they did, but still, it's a huge study with 188,000 people over an 11-year period. And again, they were looking for the consumption of these 6 beverage types. And they identified, using standardized tests, they identified the level of depression and anxiety. Those are the 2 main things they were looking for in their subject studies. And they adjusted for age, sex, socioeconomic status, physical activity, body weight, sleep habits, smoking, alcohol use, and overall diet quality. So they adjusted out for any of those outlier so that they had a pretty solid group of data. Now, here's the results. Not any surprises here for me, being a dentist for 45 years, but it might get your attention. The higher the intake of the sugary and artificial sweetened drinks, both of those first two categories, was related to a greater risk of depression among the younger, the people what they considered younger was under 50. They had 5,800 participants. Now, none of these people in the study had any history of depression or anxiety before that study began 40 years before. So they adjusted out for that too. But during the 40 years of the study and the 10 years that these researchers studied these people, 5,800 participants out of the 188,000 developed depression, and 6,400 developed anxiety disorder. So that's a pretty significant percentage, like 18 to 20%. In the under 60 age group, people under 60 who drank more than one serving of sugar-sweetened beverages per day had a 14% higher risk of developing depression compared to those who did not drink sugary drinks. Now, here's a kicker, and this one surprised me. Those who drank more than one serving of artificially sweetened drinks, for those of you diet cola drinkers out there thinking you're doing better by not ingesting sugar, the under 60s that drank at least one serving of artificially sweetened drinks per day had a 23% higher risk. So 16% with the actual sugar sweetened, 23% with the artificially sweetened drink. So just when you think you're figuring it out and doing something good for yourself by not ingesting sugar, maybe not necessarily so, at least not from a depression anxiety standpoint. Now, those who consume more than one serving of pure fruit or vegetable juice had a 19% lower risk of depression. And those who drank coffee regularly, who would have thought? Coffee gets a bad rap on a lot of levels, especially the caffeine intake. But those who drank coffee regularly, and they didn't explain this in the study why, they just reported the results, 12% lower risk of depression and anxiety. Who would have thought? Coffee is also linked to a reduction in the risk of anxiety in this age group. Now that was the under 60. Over 60, and you may find this, I found this very interesting. Over 60, there was no clear link among the same 188,000 people, no clear link between anxiety and depression levels and the sugary drinks or the artificially sweetened drinks. So 16 to 23% higher risk in under 60, but apparently once you pass 60, stuff doesn't seem to bother you. We did a study, we did one of these Wisdom Wednesdays back in the throes of COVID back in 2020, that somebody did a study online, of course, and found that people over the age of 60 were less concerned about COVID than people under the age of 30. Because why? The people over the age of 60 had already had loved ones die. They'd already had terrible things happen in their lives, divorces, marriages, all these stressful events happen. And they were like, tomorrow's going to be another day. Where the people under 30 were born after the AIDS epidemic, which was the last big terrible thing to happen medically anyway before that. So they'd never been through anything like that pandemic in 2020. And so this kind of falls into the same thing. They didn't explain why, but people over 60 didn't seem to be affected by whatever they drank. However, the ones who drank pure fruit juice and vegetable juice did see a lower level of onsets of diabetes, of depression and anxiety. So there is still some benefit. And one last kicker, and then we'll get off this topic. Tea and milk did not show consistent relationships with either anxiety or depression, although replacing milk with coffee or juice in this older group was associated with a reduced risk of both depression and anxiety. So if you're over 60, drink coffee, not milk. Don't put milk in your coffee. You're neutralizing them out. So there's my Wisdom Wednesday for this week, my health tip. And of course, this is an easy segue, especially if you're over 60. Take care of yourself. Watch what you eat and drink. Stay away from the sugary and the artificially sweetened drinks, and try to replace your soft drinks, especially the sweetened soft drinks. The straight Coca-Cola and Dr. Pepper and Mountain Dew are terrible for your teeth, but they're terrible for the rest of your body too. Try to replace them with fruit juices and vegetable juices, or even coffee, and you might live a healthier, longer life. So that's it for April for Wisdom Wednesday. We're done with April Fuels, and next week I'll introduce our theme for May. See you then.